if you want to.
Okay, hi, my name is McKenna Koima, and I'm in a group with Karina Timmermans and Abby Vetch, and I'm going to be talking today about burns. So, burns are tissue damage that results from heat, overexposure to the sun, or other radiation, or chemical or electrical contact. They can be minor medical problems or life-threatening emergencies. Burns are one of the most common household injuries, especially among children, and are characterized by severe skin damage that causes the affected skin cells to die. So some symptoms of burns vary depending on how deep the skin damage is. The most common symptoms include peeling skin, blisters, red skin, swelling, as well as white or charred skin. As you can see, the top picture shows red skin from a burn, while the bottom shows the way a burn could potentially blister. To assess a burn, you first begin by gathering a complete description of the burn injury, including the time, the situation, the burning agent, and the actions of witnesses. The time of injury is extremely important because any delay in treatment may result in a minor or moderate burn becoming a major injury. Next, a physical examination should be done to assess the airway, breathing, and circulation. Once these are stabilized, perform a complete examination of the burn wound to determine the severity. The American Burn Association establishes the severity of injury by calculating the total body surface area, a partial and full thickness injury, along with the age of the patient and other special factors. Lastly, a psychosocial exam is necessary as even small burns temporarily change the appearance of the skin. Major burns will have a permanent effect on the family unit. You should identify ways of coping with your patient, as guilt, blame, anxiety, fear, and depression are commonly experienced emotions. So some causes of burns. Most burns result from preventable accidents such as a kitchen accident, car accident, or even electrical malfunction. There are 6 classifications of burn wounds based on injury mechanism. So the first is scalds, which is usually caused by liquids, grease, or steam. And then there are contact burns, which are burns from touching the source of heat. And then there's fire, chemical, which occur as a result of contact ingestion or inhalation of acids, alkalis, or vesicants. And then there's electrical, which comes from electricity, such as getting shocked. And then there's radiation, which is damage to the skin by active radiation, such as sunburn. So because burns are a result of trauma, there are no tests needed to make the diagnosis. However, burns are based off of 3 levels. There's first degree, second degree, and third degree burns. So a first degree burn affects only the epidermis, or outer layer of the skin. As you can see on the picture, the burn site is red, painful, and dry with no blisters. Mild sunburn is an example of this. Next, we have second degree burns, which affect both the outer and underlying layer of the skin, otherwise known as the epidermis and dermis. Second degree burns are also called partial thickness burns. They cause pain, redness, and as you can see on the picture, swelling and blistering. So an example of this can include scalding, which are burns from hot liquids such as boiling water. And then next we have third degree burns, which destroy the epidermis and dermis, otherwise known as the deep layers of skin. They are also called full thickness burns, which cause white or blackened burned skin. Third degree burns could also cause the skin to be numb or even be so severe that they damage the underlying muscles or tendons. So some treatment. Most minor burns can be treated at home and usually heal within a couple of weeks. For serious burns, after appropriate first aid and wound assessment, your treatment may involve medications, wound dressings, therapy, or even surgery. The goals of treatment are to control pain, remove dead tissue, prevent infection, reduce scarring risk, and regain function. Medications usually consist of pain and anxiety medications. Healing burns can be incredibly painful. The individual may need morphine and anti-anxiety medications, particularly for dressing changes. Another treatment is using burn creams and ointments, which is used if the individual is not being transferred to a burn center. Then their care team may select from a variety of topical products for wound healing, such as bacitracin. This helps prevent infection and prepare the wound to close. Another option is skin grafts. That's for a really severe burn. So a skin graft is a surgical procedure in which sections of your own healthy skin are used to replace the scar tissue caused by deep burns. Donor skin from deceased donors or pigs can be used as a temporary solution. Another is plastic surgery, which is reconstruction that can improve the appearance of burn scars and increase the flexibility of joints affected by scarring. So the pictures show some ways you can treat that. And then follow up with proper treatment, superficial burns heal in days to weeks without scarring. Deep or partial thickness burns take weeks to heal and may be associated with scarring, while full thickness burns require skin grafting. Overall, burns that involve more than 90% of the body surface, or more than 60% in an elderly person, are usually fatal. Depending on the burn severity, you may have scarring, which may fade over time. The pictures show a burn patient before and after being treated. As you can see, there is still a lot of scarring, however, it looks much better than the first picture. According to the American Burn Association, there are 1.1 million burn injuries that require medical attention in the United States each year. Approximately 4,500 of these people die. In addition, up to 10,000 people in the United States die every year of burn-related infections because burns damage your skin's protective barrier. Overall, most burns can be prevented as well as given proper treatment if caught early enough. However, if the burn is severe, an individual should seek medical attention right away to avoid extensive nerve damage along with many other complications. And that's all I have for you guys. Any questions?